The EndoTech endoscopic carpal tunnel release uses the patented EndoTech hand surgery system and is only available through providers at the Fitzmaurice Hand Institute and performed at the EndoTech surgery centers. The EndoTech procedures have recently been highlighted in a textbook on endoscopic hand surgery. One of the articles focused on our technique for carpal tunnel release. Now let's review the EndoTech carpal tunnel release. We'll begin with a brief anatomy of the carpal tunnel. However, there is a separate video on the causation and pathology of carpal tunnel syndrome. If we take a line across the wrist and we look inside, we can see the carpal canal. The carpal tunnel is formed by bones on the bottom. There is a transverse carpal ligament on the top, which forms the roof of this carpal tunnel. Inside are flexor tendons and a median nerve. This is a closed space and therefore has a pressure inside, which should be low in the range of 5 millimeters. Swelling inside the tunnel increases pressure, and this cuts off the blood supply to the nerve. Increased thickness of the transverse carpal ligament causes stiffness of the ligament, and this is less likely to provide any compliance or space within the carpal tunnel. This increased pressure causes an increase in the size of the median nerve, which can be detected on ultrasound. Symptoms of this are numbness, pain, weakness, and eventually muscle atrophy. Let's now see how the EndoTech procedure can relieve carpal tunnel syndrome. We start by placing a small tissue expander through the minimal incision. The expander is inflated, creating increased space, and this improves visualization of the affected area. The expander is then removed. The EndoTech sheath is then placed on top of the ligament to allow complete and constant visualization of the ligament. As the ligament is released, the nerve and tendons are safe and always visible to avoid injury. This placement of the sheath also allows complete release of all structures involved for a higher success rate than other procedures. The instrument is then removed. Then we have completely released the carpal tunnel, and the pressure subsequently is reduced to a normal level with decreased symptoms. The nerve subsequently decreases back to a normal size. A frequently asked question is, cutting this ligament, does this cause any harm? The structure is not required for adequate function as long as the muscle and fascia above the ligament are intact. Multiple studies have not shown any significant long-term consequences of dividing this ligament. This is an animation of the carpal tunnel release. We begin with a small incision. The sheath is then inserted, and then we release the ligament under direct visualization. Once this ligament is released, the instrumentation is then removed, and then a nerve can reduce back to a normal size. We see here on the left, there is a minimal incision with our technique compared to the right with the large incision with the traditional open procedure. The goal of surgery is to create a larger carpal canal, which reduces the pressure on the nerve. After a period of 4 to 6 weeks, there is a reformation of the ligament. However, it is now much wider by approximately 30%, and the pressure is reduced. Most patients are unrestricted at 1 week and can resume work within 2 weeks after the EndoTech procedure. With the open procedure, return to work activity is usually delayed by 6 to 8 weeks. For patients performing light-duty work, they can often resume within days. For patients requiring more strength, such as manual labor job, they might require an additional 1 to 2 weeks. The return to work is determined by patient's comfort and strength. Let's review one option that can significantly improve outcomes after carpal tunnel surgery. The Neurogen nerve support formula was created to improve nerve function and is backed by hundreds of articles. The ingredients are in therapeutic dose that was used in these research studies to improve nerve healing, nerve regeneration, nerve function, and decrease nerve pain. Other ingredients are provided which decrease inflammation and improve recovery after surgery procedures. Neurogen has been proven to improve outcomes after carpal tunnel release. 2 articles have been published by our practice demonstrating these significant improvements. For example, when we studied the effects of using Neurogen on patients after carpal tunnel release compared to carpal tunnel release alone, Neurogen was started 5 days before surgery and continued after surgery, and they were evaluated at 2 weeks' time, and we found 43% less symptoms, 88% improvement in function, 57% less pain, and 84% increased grip strength with patients using the Neurogen. We have a few videos that can help with post-operative exercises. Go to the Condition and Treatment tab, click Carpal Tunnel, scroll to the bottom, and you will see post-operative exercise videos. This one demonstrates nerve gliding exercises and should be started within 1 to 2 days after surgery. The next video demonstrates scar massage. This should be started when the incision is fully healed, approximately 1 to 2 weeks after surgery, and will reduce scar tissue.